Hi.
Hi, sir. Nice to meet you.
Same here.
I'm Dr. Zong from Dr. Zong Medical Services from Myanmar. Could you please introduce about you to Myanmar patients?
Yes, sure. I'm Dr. Manoj Miglani. I'm an orthopedic surgeon at Fortis Hospital, Vasant Kunj, Delhi. My main area of focus is spine surgeries, and do a bit of scoliotic deformities and kyphosis corrections, and also the routine spine surgeries that we do for degenerative spine, like fusions, decompressions, minimal invasive surgeries. So I've been doing whole spectrum of surgeries for the spinal problems. That's my brief.
Yes, yes, okay. So may I know any available treatment and services available at the Fortis hospitals?
We have all the necessary equipment here, which are quite advanced. Like we have the neuromonitoring systems for doing spine surgeries to keep the patient safe. We do have cell savers for extensive long duration surgeries which have a lot of blood loss. So we do have cell saver to minimize the need for blood transfusion. Plus obviously we have a good C-arm and other equipments needed for instrumentation. Everything is kind of available here. I've been here for more than 10 years and have been routinely performing surgeries for all kinds of even difficult cases.
Yes.
We have been able to manage them.
Yes.
And we have a very good hospital staff in terms of doctors and nurses.
Yes.
We have a great ICU which can manage long cases, and we have been given good rehabilitation even to our all post-op patients.
Yes.
So I'm overall quite happy to be here.
Yes, yes,
Yeah.
yes, okay. So let me start some questions about scoliosis, because
Right.
we have so many questions about that.
Right.
Yes. Do you explain about how many different types of scoliosis and the causes of scoliosis?
See, broadly speaking, scoliosis is encountered more in children. Some adults grow up with the scoliosis, so they give you the adult scoliosis, and some people develop scoliosis at a later date when they are like old. There is a degeneration occurring in the spine that leads to deformities of the mainly the lumbar spine. So the most common is adolescent idiopathic scoliosis, which develops in children between 10 to 13, 14 years of age. That develops mostly, that becomes visible when the children have a growth spurt, there's sudden increase in height, then whatever, the spine tends to develop a bit of deformity.
Yes.
The exact reason of deformity in those cases is not known,
Yes.
but that has been observed with the most common type.
Yes.
And then there is an early onset scoliosis, and there is one congenital scoliosis.
Yes.
So congenital scoliosis is obviously most of the times visible from birth itself. And that can sometimes be very severe even to begin with, and if it is already severe and if it is neglected,
Yes.
it can lead to a lot of problems in terms of respiratory illnesses and cardiac problems, because the chest tends to get deformed. Then it leads to even gradually increasing weakness in the legs.
Yes.
So congenital scoliosis needs to be observed, and maybe we need an intervention at an early stage.
Yes.
Now, the early onset scoliosis again tends to develop some cardiac and pulmonary problems.
Yes.
So, if it is detected, we might have to go for like something like a growing rod construct for an early onset scoliosis, so that the growth of the child's spine is not compromised and the deformity remains under check.
Yes.
Even for congenital scoliosis, we sometimes need to operate on very young children to try to contain the deformity by operating at a single or two levels with hemiaphyseal or excision of the hemivertebra, so that the deformity does not progress very rapidly and does not become severe.
Yes.
In adolescent idiopathic scoliosis, which is the most common type, we usually operate when the child is nearing maturity, has already attained maturity, and the target is to correct the deformity. That is more or less, if it is not very severe, more or less a kind of cosmetic surgery, but that is quite important in terms of shape of the body and body habitus, and those things are really important nowadays.
Yes.
That gives us good results overall, because we have been able to correct most of the deformities, and then after the surgery the patients do not have that rib hump, big hump, and
Yes.
the shoulders are level, so that gives a lot of confidence to them. Also takes care of the late onset back pain which might be occurring in such deformities which are not treated adequately at the proper stage.
Okay, okay, got it. Yes. So patient also wants to know, they can happen recurrence after the scoliosis operation.
See, the chance of having a recurrent deformity are like not more than 3-4%.
Okay.
There is a chance of the fixation failure if the spine does not fuse at the operated levels.
Yes.
Then yes, a recurrence can occur.
Yes.
But most of the times, if a good fusion has occurred and if the instrumentation is okay and the deformity correction has been done scientifically,
Yes.
the recurrence rates are not very high.
Okay. So let me ask one more question.
Yes.
Do you have any available treatment options for the spinal surgery cases? Yes.
So we have been doing all kind of minimally invasive and open surgeries for the spine, starting from occipitocervical junction right up to sacrum.
Okay.
We do anterior cervical decompressions, fusions,
Okay.
posterior decompressions, fixations, and even thoracic trauma, or even even implantation of spinal cord stimulator, baclofen pump, minimally invasive TLIFs, the surgeries which do not involve much of blood loss and done through small portals.
Yes.
So I've been doing all those surgeries and we have reasonably good result about.
Okay, got it, sir. So, okay, thank you for your time, sir. Could you please any comments or suggestions to the patients?
What I would like to suggest is don't keep delaying your treatment just because of fear of spine surgeries. If done scientifically and properly with the good equipment that we have, we can have really good results and it's transforming life.
Yes. Okay. Yes. Thank you, sir. Thank you for your time.